Hey, good evening, everybody. Thank you for coming out for this program. I'm Karen Friedman Quinn, part of the programming department here at Wilton Library. And tonight we have two representatives from Oasis. They're senior advisors, senior care advisors, and they're going to talk about all different forms of care, and they will, over the course of the series, it's a 5-part series, and over the course of that you will be meeting experts in the field, and all of the experts whom you'll meet will be from agencies and organizations that are local to Wilton or within a short drive from Wilton. So the information you're going to get is going to be specific to those of you who live here and within a 5-mile radius of Wilton. So I will quickly introduce. This is Susan and Paul. And Susan and Paul are, is it a secret?
No.
A couple.
Yeah, we're married. We've been married
They're
35
married.
years, yeah.
I think you're getting
This is 9 years together.
That's the one joke we will tell is, you know how they say dog years?
Yeah.
There's the amount of years you're in business with your spouse, 8 years compares to
dog years,
35.
But we're still married. And we're still working together, so we're very happy.
So we're very happy to have you here tonight, and
Here we go.
yes.
So thank you all for coming out. We do call this a sandwich generation because it was cute when it started, but it speaks to a lot of different people. And as Karen mentioned, this is a 5-part series. Tonight we're going to do the 10,000-foot view of the whole thing. There are going to be some things that are new to you, some that may not, some that are puzzling to you, and so over the next 4 months, we're going to bring in experts and dive down on each of those things. So next month, we're going to talk about what we call local lifelines. So what are the resources from the town and the state that are available here, and the people for you to connect. And the people is really the operative word for us, because over this course, if this is successful, it's gotten you to think about things, and now you have a cadre of people that you know you can reach out to when and if you were to ever need something. So we'll have local lifelines. Then we're going to do a whole session on staying in the home. So what do we need? Assessments of the home, people that can come in, equipment that can come in, life hacks for staying in the home, because that's obviously our first goal. Then we're going to talk about what we call operating instructions. So that's the legal night. We have 2 great lawyers that come in and to talk about all the legal issues that accompany senior care. And then we'll wrap up with what we call Sound Serious, which is about skilled care. And we'll touch a little bit about that tonight. Is what's the difference between when I need a little help around the house, or I'm having trouble with a couple of things, and when I really need a skilled clinician, and what do I do with that, and how does it handle both in and outside the home. So that's the series tonight. As I say, we start with navigating Senior Care 101, 10,000-foot view, a lot of information. There is no exam, and you can always come back for more. Okay, so we will touch on things, and it goes pretty quickly. Some heads will spin. So,
And this, there's a bunch of information over there. This is the curriculum for the next 5 months. So if you wanted to grab anything, feel free. So I kind of gave you a little heads up. So we've been in business for 9 years together, married for 35. We are Oasis Senior Advisors, we're business owners. Okay, so we were really frustrated. We were in this situation. I'm currently in the situation with my mom that it's really hard to figure out what the next steps are, what the care needs are. Paul was pressed into when his father was diagnosed with a blood cancer, and then his mother had Alzheimer's disease, right? And dealing with that, what do you do? There's no, dummy's guide. There's no handbook. Everybody's situation is unique, and so there was no guidance. No guidance. So we became that source, wanted to be that resource for people to be able to listen to them, understand what they need, and to be able to cobble something together. And if it's being in the home, that's what this whole series is about. What does it mean? What does it look like? What does it cost? What does it take?
Okay. So I found this place, One Happy Healthy Life. I don't even remember what it is anymore. It's a spa or something uptown. We've all seen this graphic, right? It's a map. And that's pretty good traffic. It's a blue line, means I'm not riding on 95, and I'm not riding on Merritt going one way or the other during rush hour. But even here, we see that there are different ways to get someplace. And I also know when I get further up on Route 7 by Danbury, it's probably gonna change. It's gonna go a little yellow, because there's gonna be there's been an accident, or there's a truck. And then when I get into the back roads, I'm gonna get stuck behind a school bus and things aren't gonna move quite as fast. Well, that's what happens with senior care. We don't all live to 105 and get hit by a bolt of lightning after you're coming off the tennis court. It just doesn't happen. Things happen for some people. It's a lot for a long period of time. For some, it's not. And we'll say what's happened generationally that we've not had to deal with before is the difference between lifespan and health span. Everybody knows what lifespan is. I'll give you an example that will put it in some context. In the mid-60s, when Medicare and Medicaid were written into law, the average lifespan of an American female was 74 years old. So 74, if I told you a woman died at 74, you'd say, it's tragic, that's young. And the system was built to take care of you in your retirement, which was in itself a new concept because people were able to stop working. But it covered 9 years. That was the expectation. And we've bandaged the system since then. So it's flawed because we have the same system and now we're living into our late 80s and covering the same thing. And over that period of time, we're just generally unhealthy. It used to be that you got sick and you passed away. Cancer got you and we didn't have a treatment and you died. Heart attack, things like that, but we didn't have treatments. Now we have treatments and you're gonna live long, you expect to live longer even when you have something serious happen to you, but you're gonna be in a compromised situation. So we're gonna help you work on the roadmap. Now, when I'm on that target, I mentioned the school bus, I mentioned the traffic. What are the things that happen to us in life that mean I'm running into trouble, that there's some red lines on that blue track? So we look at, is everybody okay overnight? Are things starting to happen overnight? I'm going to the bathroom more often. I'm not really good on my feet, or I'm cloudy when I get out of bed. I'm okay, but I stumbled, I hit the door jamb 2 weeks ago. I'm okay, but that evolves into something more. Driving, I do it. So you know what? It's pouring rain and it's dark out. I'm calling and canceling because I just don't want to get on the back roads and do it. Those are things because my vision is not what it was when I was 30. Those are things that are happening. Our houses get little bits of clutter or just accumulation of our histories and our traditions. They get in the way. Because if your footfall is just a 1/4 inch different than it was when you first got into the house and you can't make it over that throw rug that's just been there forever, you can stumble and you can be totally fine, or you can catch the side of the coffee table and you go down. And you might bounce, but you might hit your head. So we look at those things. Memory loss, I think now we have an entire generation that every time they forget something, they're afraid they caught dementia. But you can't catch it. But these are things that get people nervous, but should also be, okay, what do I do about this? And it's gonna be different for everybody. Medications we're taking in the treatment of all those illnesses. we're taking a lot of medications. A lot of our clients take a ton of medications. Think about the amount of pills that you're taking now or that a senior loved one might be taking. It can get confusing. And if something was changed because on the last doctor's visit, they noticed that your other physician gave you something else, so he changed your meds, and now it's a white one and not a yellow one. Now it's a big one, it's not a small one. I'm supposed to take it before food or after food?
Or you got it from Walgreens instead of CVS and the color's different, right?
Okay. The first thing you take away from here is the things we're looking for help on don't in and of themselves sound serious. We're not talking about coronaries and lung disease and things like that. We're talking about ADLs, activities of daily living. That's what everything is. It's the entry drug to care. Activities of daily living are dressing, bathing, toileting, transferring, and your mobility. I'll give you a simple one, two simple ones on what assistance with dressing can look like. I've got a little arthritis in my fingers, and I love my button-up pajamas. But in the morning, if it's damp outside, I really have trouble with the buttons. So you know what? It's okay. I'm not going anywhere today. I'll stay in this all day. So I'm gonna have pajamas all day. Or I got poor circulation in my feet. Doctor said pick up some compression socks at the store. I did it. Works wonders. It's really, really great. Until I have to take them off at night. I'm really tired. These things really stick. They're impossible to get over my heel. Mary, come help me. Because, oh, Mary's not there. I bend a little too far down. I lost my balance. It's really innocuous, but that's what happens. Those are some
Or
of
even
the.
just a bra for a woman. My mother, she can't do this anymore, so guess what?
It's not the 60s.
Right.
Yeah, and she's not frail per se.
No, she's
Okay, so
So what are the roles, right? What does it mean? What does caregiving mean? What are the roles that are involved? Are they caregivers? Actually, people that deliver care, that help with those ADLs. Do you need help dressing? Do you need someone to just stand by if someone needs to go take a shower? Putting those shoes on, all of those things, right? Transferring. Can I get up out of a chair and transfer? Right? Can I get up off the toilet, or do I get stuck? That's for caregivers. Drivers, do you need help? Do you need to be driven around? Can you drive anymore? Do you remember how to get places without GPS? Do you have a flip phone and you can't use Uber, right? So how are they gonna get around? How are we gonna get the shopping done? Doctor's appointments, this is a big deal, right? Scheduling and attending. As we get older, even me, when I go to the doctor tells me something I don't want to hear, or even I do want to hear, I can't retain it, I forget. And to be able to get that information and follow those orders or whatever is important. And then scheduling those follow-ups. Who's gonna do that? Are you gonna rely on my 87-year-old mother? No way, no way. Socialization, are you part of their social engagement, right? My mom, she doesn't leave unless she goes to the doctor. You know, she relies on people to come to her. I mean, it's that we become her social circle. Is that important, right? Like, do you need to do more? Legal issues, that's another big piece. You know, this is all part of caregiving, making sure, and we're gonna get into it in a subsequent section. Powers of attorney, healthcare proxies, advanced directives. Are these in place? Have you talked about it? Really important. Financial. Are the bills being paid? Are they being delayed? You know, who's taking care of all that? That happened with my dad. My dad, super stubborn, Italian. He's, you know, the youngest daughter's not being told anything. But I was able to get in there because I said, some stuff's going on. Someone has to know. So these are roles of caregiving, things to keep in mind.
okay, so how are we gonna fill these roles? Well, the first is gonna be my spouse, it's gonna be my kids, it's friends and family, and they're gonna be there. So when we do this piece, which is the easiest, and the hardest. We have to have an understanding of both sides and what the expectations are. Where is this gonna work? Should mom come live with me, or should we move in with her? And that's fraught with family dynamics and all sorts of things, and physical about the building that we're in. So we gotta pay attention to that. How much time will it really demand? I will tell you the one thing everybody gets wrong, how long it's gonna take. How much of your time it's going to take to help somebody. Because you also don't know when it's time. I'll give you an analogy that we talk to when the boomer generation is taking care of their adult parents or their senior parents. One thing that they miss is that they're still in control and they have an opinion. You just can't land there. So with the time, it's also for how long. This is gonna be open-ended. If somebody's broken an ankle and they need some help around the house for a month while they rehab, well, that's one thing. But if we're really talking about senior care, it's gonna take a period of time. So is this open-ended? And how do we do this? We need to respect the sacrifices that are made on both sides and have very frank discussions. And it's not gonna be a single discussion. It's gonna be a conversation over time. And that's what we hope this will spur, is start having these conversations, because if you have them as little ones in the beginning and it becomes a habit, they're easier to have than when you're calling the Doyles from your mom's hospital bed or from her rehab saying, we just realized she can't go home and now we gotta do it all now in the next 2 days because we're told we're being discharged. Okay.
I mean, that's a huge piece, their expectations and how will it affect the lives of others. Just a little quip, my mom's on Long Island. I live in North Stamford. My sister lives farther out on Long Island. She's the nurse. My brother was living out there too. And we were all, doing the best we can because that was the expectation. Oh, my kids are gonna be there. Until it became insane, right? Mm-hmm. So then what was the next step? And we had to work together in crisis, right? Because it's a hard conversation to have, but really, really important.
And there's a bit of a trap that can happen here. And then, don't get me wrong, this should be encouraged.
Yeah, oh, totally.
But when people get further along in it and they get burnt out, you'll hear about caregiver burnout. Well, when it's a family member, we tell plenty of the adult kids, you need to stop being a caregiver now and be the adult daughter or the adult son, because your parent is aging and you're getting to the end of their life and you don't want to be their caregiver at the end. And they don't want you to be the caregiver. They want you to be the adult daughter and the adult son. As a family, I will tell you, having gone through this so many times now with clients and having gone through it with ourselves, that's what you want. And it's a bit of a trap. You wake up one day and you realize that I really don't want to walk into mom's room right now because it's hard work, not big.
It's stressful. Right.
And it's an awful realization.
So who's going to do it? We talked about family stepping in, always usually the first situation. And then you can hire someone privately, okay? How do you find that person, right? A lot of times it's word of mouth. Oh, my friend's mom had an aide and I'm going to use them. Fine, perfect. We call that a registry, right? What you need to identify is how long you need someone, when, what days, and what are they going to do? What are you going to pay them? What is their cost? Can you trust them? Who's doing background checks? Do you have the liability insurance if you hire someone privately? If they fall down and hurt themselves, they could come after you. Big thing. What's the backup plan if they don't show up, right? Mm-hmm. Maybe, I don't know, they had a bad day, their kids are sick, their car died, whatever it is, then what happens, all right? And these are people that you're hiring privately, so you really have to keep this in mind. It might be less expensive, money-wise, but it's also time and things that you really have to take into account. It sounds like you're an employer because you are. You're hiring them privately. You know, just understand what you need to do if you find someone.
And so it's an important point. So Susan touched on the liability issue. So if somebody's helping your mom get up and she hurts her back, or they both of them tumble, and the person who's helping takes the worst of it, does your homeowner's insurance cover somebody who's in your employment getting hurt on your property? Most of it will, but it's a question we need to want to ask.
And the last part about this too is that, you know, if you're an employer, you're supposed to have withhold, you know, do tax, you know, the withholdings, all of that. You don't do that, okay? Plenty of people do. You know, I don't judge, but if, let's say you let that person go and they go and try and collect unemployment and you say, wait a minute, right? That's a whole nother thing, the whole it being an employer, very important.
Yeah, so it's a great point, right? Somebody leaves your employment, they go to the Department of Labor and say, I'm out of work, I need to get unemployment insurance. The way that works, for business owners know this, many people don't. Department of Labor says, who did you work for? Oh, the Doyles. Okay, you guys haven't been paying your insurance.
Well, we have.
We need that. So it doesn't happen all the time, but it can, and this is just about going in eyes wide open. Okay, so an alternative, hiring an agency, that's where all the back office stuff goes. And you've seen them, there are 1,500 home care agencies in the state of Connecticut. Name them. It's a lot, okay? A lot of very good people in there. We're talking about hourly wage people though, doing this work. So it's hard. A lot of people will say, oh, we don't need much help. I'd really just like to have somebody come 3 days a week. Be really helpful. Come in the morning, get me started. Need about 3 hours, 9 hours at minimum wage. You're living in Fairfield County. Where are you living on that? Okay? So first of all, we need transportation. Second of all, you're not my only gig. And you're not a very important gig to me because I'm making $100 a week from you. I'm waiting for that first person who's going to give me a 12-hour shift or a 24-hour shift because I got to feed my kids. Doesn't mean they don't like you, doesn't mean they're going to give you bad care, but you're not an attractive job. You know, they can certainly make more money at Chick-fil-A. Okay?
McDonald's.
Yeah. For sure. So you'll also get a rotation of people. So the idea of, oh, I'd love to have a woman. Can you get us a nice Irish woman who can come by and take care of my mom about 9 hours a week? No.
Maybe you can.
Well, maybe I can.
Maybe
It'll be a different one next week, and the week after, and the week after. Okay. 2 quick little hacks because we will go into this really into the detail. 24/7 care. The top. 2 ways to do it. Least expensive way is a live-in. Live-in needs to be able to sleep 8 hours a day. It's 3-hour-long breaks for lunch. That's the framework. Can they get up in the middle of the night? You have an emergency? Absolutely. But if it's a habit, they need to be awake. And now we need shift work. So it's 3 8-hour shifts, 2 12s. Nobody can max out over 40 hours, so that we go overtime. So now, do the math. How many people do I need to have in my house over a given week that are also going to be rotating because nobody wants to work the weekend, especially overnight. So it gets difficult, and you're just running your risk of you're going to get somebody who's not right.
But the agency, so if you hire an agency versus what I was talking about, hiring the private person, you know, they're doing the background checks. If that person, they're doing the scheduling. If the person doesn't show up, they're finding the replacements. If there's no fit, like if they just don't fit with your loved one, they're gonna find a new person and do that matching. They're gonna do all the withholding and the insurance and all of that kind of stuff. So you're paying for that. Right, you're paying for that.
And that backup plan.
And backup plan. So, you know, that's not insignificant.
So if that's snow day, they can't come, it's not on you to find the stuff, it's on them. And they'll have to do that. Now the cost, we mentioned before, if we're hiring privately, I found somebody from church or we found somebody who's sort of working on the side, a side hustle. We have, some, yeah, it's 20, right now we have somebody who's doing 28. We found they would in a pinch do 25 for somebody. If you find them, again, you have to be really diligent. We happen to be very fortunate that this is somebody really good. Otherwise, if you're dealing with an agency, you're gonna be looking at 30, 40, even $45 an hour. So you can do the math. You wanna watch overtime after 40 hours and 8 hours in a day. I mentioned the 24/7, if it is a live-in, that's gonna be the least expensive.
It's somewhere between $350, $400 a day, and they're sleeping at night, right? Sometimes $450 a day,
Yeah.
depends on the, right?
Somebody was $595 the other day.
Oh geez, really?
Yeah.
Oh my goodness. So Justin Brown and Ashley Tigliano, they're part of our team too, so should have introduced them, so kind of looking at them periodically.
Okay, so now, if that's working, that's great. But what happens if it doesn't? What if home's not starting to work? How do we keep this together if one of us needs more care? Or how do we keep a couple together if one needs more care? This is a heartbreaking time where we have somebody, one spouse has dementia, the other spouse has been the caregiver. They've been a saint, doing a great job, and it's just getting too much because it's a progressive disease. It's gotten worse. It's gotten more demanding. I can't do it.
Mm-hmm.
The worst realization for someone who's been married a very long time is that I can't take care of my spouse. I do not want to say that to myself. I do not even want to have it as a realization.
Mm-hmm.
And it doesn't mean you're less of a partner, but it's a reality. And it will happen. We have to raise issues of a caregiver. If a caregiver has a little accident, they get rear-ended on the merit because it's bumper to bumper and the guy behind me wasn't paying attention. Bam! Really screwed up my neck. I'm out of whack for a week. What am I doing? What am I doing about my spouse?
And also the burnout. I had a client, his wife has Parkinson's and dementia, and he was sick. His doctor said, get to the ER right now. He goes, I can't leave her. And he didn't.
Wow.
So it was, yeah, it's a lot of stuff. So what are your backup plans? What else can we do?
So there are some options. A favorite, although I wish we had more of adult day. I don't know if you know Elder House over in Norwalk. Mosaic up in Bridgeport has one. There's one in Stamford. There's one in Greenwich. It is what it says. It's adult day. You can drop somebody off at a building, and it's like camping. And they have activities based on the abilities of those who are engaged. It's less expensive than having a caregiver in the house.
They'll give medications. They'll give showers. People with early dementia, sometimes the showering becomes difficult,
Mm-hmm.
and to let someone else take that over, a couple of times a week is helpful. But they get the meals, right? They'll deal with, diabetic diets, things like that, things to think about.
The other time at home, it's uncomfortable, starts to work sometimes with dementias. Of course, there's wandering.
Mm-hmm.
And it's in the beginning, it's innocuous. Well, he was always a walker. He likes to walk. Okay? And he still can. He's very able-bodied. But he has these moments where he loses orientation to where he is. It can be really subtle sometimes, and it only has to happen when I approach that door. And I open that front door, and I'm out,
Mm-hmm.
and I make a left when I should have made a right, and now I've lost it. Or I just do it in the middle of the night, and I have lost orientation of time, so I think it's just time to go to work, or I need to go see somebody in the neighborhood and get outside, and it's dark. And that's when Wilton PD shows up, because people have gone banged on the wrong door, the neighbor's now terrified because somebody's banging on my door at 3 o'clock in the morning, shouldn't happen, police are involved.
Or even what's the trigger sometimes, right? I had a client that used to fly all over the world, right? And he'd hear the plane and pick up his briefcase and go, take off, right? So, happens, right? Where am I?
The other piece is just that the care gets to be too much. Remember, we did the math, let's say paying $35 an hour for over 24 hours. Do the math, a lot of money. It's just a lot of money. And again, that health span, lifespan, what we start to need to build a habit of people, it's always hard planning for retirement, right? How much money do I need? When is it good that I can afford to retire? Well, now we're retired for such a long period of time. There's a retirement 2.0, and that's this time. And if you don't, with a financial planner or with yourself or however you do it, start thinking about these things, you can really be sandbagged by it when it happens. To think about it, that's why we say have these conversations. What would you like if? What's palatable? Do you like having somebody in the house?
No, I don't want them in the house.
My mother, when we had an aide for my father, felt she was entertaining. And it wasn't a positive thing, it was an unwanted guest. But this woman who came from, we lived in Scarsdale, but coming up from Mount Vernon, and she's like, these are not my people. She's in my house, I have nothing to talk to her about, and what does she like for lunch? I don't have anything for her. You're not supposed to. But
She had Alzheimer's too.
and then when my father passed, we realized he was covering for her Alzheimer's, and okay, so let's say we get to a point and we're considering what's going to happen if the house isn't working anymore. What's out there? Okay, we're going to talk about categories here. In a 10-mile radius of where we're staying right now, 17 assisted livings. Sorry for the acronyms, but now you're going to have them all. You have ADLs already, ALs, AL, IL. AL is assisted living, IL is independent living. SNF, anybody? Skilled nursing facilities,
Yes.
nursing home. Okay, all with it. So that's 30. That's 2,500 to 3,000 people that are living in those buildings within 10 miles of where we're sitting right now.
So we're gonna get into each of these categories, right? Okay. Another acronym, CCRC, Continuing Care Retirement Community, okay? That's Meadow Ridge, 3030 Park in Bridgeport, Edge Hill. We don't have that many around here, but basically what a CCRC is, it's a life care contract. You're buying into a life care contract. You get buying into this independent living apartment, and which is guaranteeing the continuum of care. They'll have assisted living, memory care, and skilled nursing all on the campus, and you have priority access to all of them. Now, each of these life care contracts are different, and each of these buildings do things a little bit differently, okay? So, with some of them, if you buy your apartment, for $1 million, yes, the buy-ins are very steep. You'll still have a monthly fee. Off the top, let's say it's $8,000. For some of them, it's going to be $8,000 for assisted living, $8,000 for memory care, $8,000 for skilled nursing. Great. Others, you're buying into the continuum of care, and then it becomes whatever the market rate is as you move across. But you're literally moving across, okay? The other part about them is that you have this buy-in, and they'll have a certain amount that they'll return to your estate when you leave or pass upon sale of their unit, which I think is now 2 years. They have
There's
maxed.
now a cap on it.
Yes,
They didn't
used
have
to.
to
They
give you
used
the
to.
money when you vacated. They had to give you the money when
When
they sold it. So they were not incentivized to sell them, and then several years ago, they put a cap on it. But it can be 2 years.
Right, so, but some of them have 90% return, 80%, 50%, declining balance. They're all kind of different, depends on the A, B, C, there's all kinds of contracts. But understanding what it is it's almost like a hedge in a long-term care policy. You know what, you have it all, right? You have the ability to progress across, so that's a benefit.
It's a great analogy.
It is.
It's a long-term care policy for somebody who's over 60. Because once you get to 60, it's going to be difficult to get a long-term care insurance policy underwritten. So it's starting to come up with devices. This is one. So they are different. Is every insurance policy the same? So these aren't all the same. You need to look at what each offers that way.
But you also need to go in independent. in order to qualify for the life care contract,
Mhm.
right? If you go in and let's say you already have a dementia diagnosis, right? You have a little bit of memory issues,
Yeah.
okay? You're a couple, one might qualify, the other might not. It's really, you have to be very careful. There's all kinds of tax, wonderful tax benefits and things like that, but you have to go in independent, very, very important. And the flexibility is not really there. So if you do this big buy-in, and let's say my daughter moves to South Carolina, it's just a piece of it, go in eyes wide open, understand all of that.
Mhm.
They're
Okay?
beautiful.
They're
I
beautiful.
don't know if you've never been to Meadow Ridge, it's stunning.
Gorgeous, yeah. Then we have the next category, so that's the CCRC. Then we have independent living, right? And we're gonna talk about, so senior housing, those are HUD housing, subsidized senior housing. And, they are around, there's never enough. So it's based on a certain percentage of your income. So it's more lower income housing. You get your own apartment. You can get services in there through SWACA, Southwest Connecticut Agency on Aging. You can get a list of all the places around the county. And it's really an application, really long wait list, definitely worthwhile because it is affordable. So Ogden House and Wilton Commons, those are two of the local ones.
There just aren't a lot of them.
There's not a lot of them.
And
And there's no services, really. I mean, you can go for meals, right? There's,
yeah,
My
it's
big
easily
case manager.
facilitated from the outside, and we'll have somebody from SWACA,
we have someone from Salt.
and local lifelines will come down, so they'll be able to address that.
Mhm.
But that,
Go ahead.
so then the next is independent living, what we talk about ILs, okay? So we're talking about AL, IL, CCRCs. These are communities that have independent living. They're licensed for independent living. This means they have full kitchens,
Mostly.
okay? Mostly they have full kitchens and some limited services. So some care can come in. Some of them might have care packages that you can add on to. Others, you're bringing care from an agency or from an outside person to help you, with that shower, with all those things. But you'll be able to get your laundry done, the meals are there, there's all kinds of activities, transportation, and they're month-to-month rental. So not that big buy-in that we're talking about. You sign a lease, generally there's a 30 or 60-day out clause, so you can break the lease should you want to leave. The ones locally, Atria Darien, and at Waveney, and Keystone is up in Danbury. They have an independent living section. They also have assisted and memory care. But those are, so those are the ones around here.
So just to underline this, the independent living, and when we talk about independent versus assisted living, which we'll get in a second now, we're talking about the licensure of a building. So independent living can't deliver care. They can't be responsible for delivering the care. Assisted living can, and so they have staff that will deliver the care. It doesn't mean you can't be in assisted living with independent. Okay, it just means the building, when we talk about it, the building is licensed for assisted living. What we're able to do is find cohorts of residents. You'll get it. I'll give you an example. We've seen so many of the new buildings come up. You had one, Sunrise hasn't been open very long. When they first opened, everybody in the building was independent because anybody who had urgent need couldn't wait for the fire department or the building inspector to come by and give them the final C of O. It was always, like it happens with construction, it was pushed back 3 days, it was pushed back a week. So, okay, we have to go somewhere else because moms really need something right now. So everybody was independent. It was really buoyant. Now it's been open for 4 years. People are aging in place. It's great. But now the frailty of the residents are there. You can find plenty of assisted livings with independent cohorts of people. Susan mentioned month-to-month rental. You're not cooking, okay? We get somebody, I love to cook. They're gonna give you 3 meals a day, restaurant style, with not a cook, but a chef. And it's the social tent poles of the place. You're going to the meals and you don't want to do the dishes. You don't need a kitchen. You don't want a kitchen.
Mhm.
But I get it. And we hear that a lot. They'll do all sorts of things for you, laundry, transportation, they've got the activities, the medication management, we talked about that. That's really easy for them to do. Scheduled care is really easy to roll in. So if somebody's having a bad week because I got bronchitis and now I'm just like, I can't get out of bed, or I'm busy all the time, I need somebody. They're there. You don't have to go find a home care agency, they're there. Examples of these, the brands that are around here, so Brightview, which is on New Canaan Avenue, just south of the Merritt in Norwalk. Benchmark has several. They have Sturgis over in Fairfield and Fairfield, and in Stamford. Maplewood's got a bunch around here, from Newtown to Stony Hill to Strawberry, which is in Norwalk. Atria is mostly south of here because it's Darien and Stamford. Brookdale has one right over here. Sunrise has one down here and has 3 others in the county, 2 others. Three others, Fairfield and Stamford. LCB has a couple. The residents, the next one is probably Westport, right on Post Road. Selleck's Woods in Darien. Greens and Cannondale, you all know, tucked in behind Wilton Meadows. Okay, so that's sort of the lay of the land. There are other things there. Here's the thing people don't realize. See, you're not being put away, institutionalized. These are supportive devices. Okay, so I just started in the last couple of years using reading glasses. I've needed them for a while. Yeah, I'm stubborn too. I don't need these, and it's a pain in the neck to go to an optometrist, and my coverage doesn't pay for it, so it's like, okay, I'm doing that, I get it. And in noisy rooms, I'm having trouble with the white noise. So I can see your lips going, so I know you're lying, but I can't hear you.
Yeah. That's cool.
But I now have the glasses. If I get hearing aids, I'm gonna be the first one to sign up for those buggers. If I've got a bad ankle, I might use a cane or use crutches. Those are adaptive devices. That's all these buildings are. But I don't want to mow the lawn. I haven't been to a movie because it's a pain in the neck to get out every night. I miss seeing people on a real regular basis because I'm a really social person. And then they just shrunk it down so there's a whole city in there. So it's a movie every night. I'm eating at a restaurant with friends every night. I've got activities going on. It's like a cruise ship that doesn't leave the dock.
And it's not a nursing home. People think they're nursing homes. They're not nursing homes,
Right.
but can deliver the care.
You're living in an apartment, studios, 1 bedrooms, 2 bedrooms, you decorate them. You bring your furniture, you dress it. Our mother was down to 2 rooms, the den and a bedroom. I moved her into the Bristol and White Plains. I recreated her bedroom.
Mm-hmm.
Everything was in the exact same position.
Mhm.
It was a different room, don't get me wrong, but when she woke up, that nightstand that had been there for 45 years was right there,
Mhm.
and the dresser was right there. And that's what you do. Cost, people ask us pricing,
How much does it
how much does it
cost?
cost? There are so many factors. Size of the apartment, location in, Sunrise changes their prices based on census, where it is in relationship to activities, where it is in relationship to the elevator,
To the
what
nurse?
size of it, to the nurse's station.
How long
To
does
get a
it
bid on the pricing that holds for more than 7 days is tough. Now, they don't go whipsaw, don't get me wrong, it doesn't go from $100 to $200, but it moves because they're actually trying to be transparent and not beef it up too much.
Mhm.
And then there's care. So what they'll do is there's a rent piece, you're paying your rent, and that gets all of those things that are in the first section, and then your care. I just need help with those compression socks. You're low care, don't worry about it. I'm a 2-person transfer with a Hoyer lift. So I need 2 people to get me out of bed. I'm a big guy, I need 2 people to get me erect, okay? That's high care. It's gonna take a lot of man hours to get me in and out of bed, on off a toilet, in and out of a chair, into dinner, out of dinner, into an activity, out of it. A lot of manpower. So that's gonna be highest level of care. That said, you're gonna find rents that for studio at the lowest end is gonna be, probably find some place for you at $4,000 a month. It can also be $9,000 a month. And the care levels will go in $1,000 increments, from 0 to 1,000 for the first care level, and could go as high as $4,000 or $5,000 on the high end of care. So that 2-person transfer, or a Hoyer lift, which is literally like a human crane to get you in and out.
But there's plenty of people who just want them to handle their medications. I don't want to order them anymore. I need, I'm a diabetic, or I'm Parkinson's, or nothing. I'm not taking anything. I'm just afraid to be alone.
So you see the combination we talked about, what care in the home, we're paying the hourly rate to a home care agency, or I'm paying for one of these places, it's expensive. That's retirement 2.0. For most people, if you do not have long-term care insurance, a lot of times your home becomes your long-term care insurance. Especially around here, that home you've been in for 30, 40, 50 years, well, you bought it for $40,000. And so you did a great, great job. You did provide for yourself. Unfortunately, people don't realize that, and that's where we get into sort of the financial planning of this, because it's very expensive.
I just want to, briefly, so I'm working with someone right now who says sometimes they don't need anything. A spouse that passed away, wife took care of everything, and husband, sorry to give the husbands a hard time, but can't do anything without her. So he's moved into a place and get that socialization, everything's taken care of, and he has no care needs. To the other extreme of someone that I'm working with right now, who is currently in acute rehab in a hospital, who is a 2-person transfer, diabetes on insulin, oxygen, nebulizer. What were the other things I said? Actually, oxygen, catheter, because now there's so much stuff going on with this guy. You're like, oh, he's in a nursing home. No, he's not. He's not. So the extent of the level, and not every place can do it. Let's be honest. And we are very careful about someone who's got a lot of stuff going on, a lot of medical issues, that they can take care of.
It's not a monolith, right? We've learned both in dealing with that health span, lifespan difference, and COVID taught a lot. Okay, COVID taught a lot, because the assisted livings all closed their doors. They didn't take people in. It was the nursing homes that had to have people coming in, and where it really ran rampant. There were a couple of assisted livings where it ran rampant, but most of them, they pulled up the drawbridge, and they just said, stay out, and they did okay.
Whoever was there, nobody came in.
Right.
Yeah.
Right.
And Ashley worked at a nursing home. She was at a nursing home, and so we could talk about that offline, because she's going to be doing a whole session on the skilled care and what it looked like.
So there's some that came out of that, and they really do very close to what would be nursing home care, and we're going to get into that in a second.
And I just asked a quick question about everything up until that point. You have to figure out how to private pay for all of that.
This is all private pay, yeah.
Well, we're going to get into that in a second.
All right.
Of how to pay for it and what are those parts, yeah. So memory care, it's specialized assisted living for those who have dementia. Usually a dementia diagnosis, right? It's a smaller environment. Some of them are memory care only. Some are neighborhoods within an assisted living. Okay, specialized, they're trained to deal with people with dementia, redirecting. They're staffed higher because they know that if you've got cognitive issues, you can't self-advocate. You're not gonna, I need help, I don't feel well. It's usually a behavior that's exhibited, right? So it's staffed more. So examples, the secured neighborhoods at Sunrise are called Reminiscence, Evergreen at the Greens, Clarebridge at Brookdale, that's just the name of the section. They're secured, okay? So it's not locked, we don't say locked. It's secured to prevent those people who are elopement risk. As Paul said, I see that door, I'm gonna walk out, I don't have safety awareness, I can't advocate for myself, right? Memory care only, Bridges in Norwalk and Trumbull, the Village at Waveney, that's memory care only. The cost, 10 grand, starting at 10 grand, 10 to 14, okay? Some of them are all-inclusive. Now they've started to change. It used to be all-inclusive. Okay, you can do this, and we're gonna pay for everything. Then they realize that people are getting more acute, need more care, and they need to staff more. So now sometimes there's an enhanced care level if you're a two-person transfer. If, you know, maybe there's other fees if you get higher. So that's why we're saying somewhere, you know, 10 to 14 can be higher at some other places. I know some places that it's 20 grand a month. It really depends, but roughly that's what it is, because care costs a lot.
Okay, differentiator of assisted living to skilled nursing. The simplest terms is I'm there for two reasons. There are two sides to a skilled nursing facility. There's the rehab side, the short-term side, and long-term side. Short-term, I think we sort of understand that I've gone in for surgery, I'm going in for something, I broke my hip, I'm gonna come out, I need rigorous PT, and I'm gonna be in there for a period of time. Medicare will cover that for a period of time. You need to know, everybody's, oh, I get 100 days. That's the max per incident. Well, yeah, per event. It's dictated by, it's a prescription. So if you have an allergy and doctor says, well, you have the spring cold, and doctor gives you 30 pills for 30 days, after you gotta get them to rewrite the prescription, or that's the course, that's all it's gonna be. When you come out of the hospital, you have a broken hip, we have a procedure for doing this, this is what you're gonna need. The PT isn't just winging it. He's going through particular order things, and you will be, Medicare will continue to pay for it until one of three things happens. You hit your goal. Your goal was you need to walk 50 feet unaided, okay, and PT got you. The moment you hit that, they're reporting back to Medicare. Medicare says, great, you're done. We're gonna stop paying. If you plateau, can't get to 50 feet. I hit 40 feet. And it's just, I'm trying, I just can't get there.
Or I'm not trying.
Well, and the third one is, I don't like this. This is hard. This guy's yelling at me all the time to walk further. I'm not doing it. You're non-compliant. Medicare hears you're non-compliant, covers debts. So that's short term. Long term, it's also for skilled care, right? We said skilled nursing facilities, skilled care. What's skilled care? Intravenous, feeding tube, breathing tube, respirator, wound care. I'm bedridden for a while, I've got older, weaker skin. I had a sacral wound. Probably the most common one, Ash.
Yep.
Okay, and I'm still on it, so it never gets better. I get stuck. So we need things for that, because wound care and aggressive wound care is a skilled need. As long as I'm in short term, as I say, this insurance will pay for it. If I need to go long term, and I'm going to stay there, and generally people stay for one of two reasons. I need continued long term care. I'm on a respirator, and I'm staying. But a lot of people, it's because of the cost, and Medicaid will cover a long-term stay in skilled nursing.
Most skilled nursing.
Okay, because otherwise, the skilled nursing in this area is really $600 to $800 a day. We need it's probably about $600 to $800 a day private pay now in skilled nursing. Where this comes into play a lot more frequently is somebody's done their rehab and they're really not comfortable going home. Well, you can stay, Medicare's not gonna pay for it. And so you can, if it gets you a little buffer, and I don't like to spend people's money, but sometimes it's wise to spend $600 for 4 days to get you that extra couple of days to get you really back on your feet, so you're prepared to go home, or prepared to go to assisted living, or prepared to go back to your daughter's house. So the ones around here, you're gonna know, Wilton Meadows, we talked about, Autumn Lake, Notre Dame, Kissimmee, Norwalk, Waveney. They're very different, and because that Medicaid factor, here's how Medicaid factors into a lot of this and defines what a place is. These are complex facilities that take care of people, and it's about the staffing. When their population goes from paying either a Medicare rate, because Medicare has a good reimbursement rate for rehab, to private pay, $500 to $700, that's good, it's a fair amount of money to
But
take
not
care
as
of
much as
people,
Medicare.
but not as much as Medicare, because they also bill for the other services. But if I'm Medicaid's reimbursing you like 40 or 50 cents on a dollar. So I'd like one of you who's running a business to tell me if I cut your income or your revenue 40 or 50% on one customer overnight, how you kept quality service up. And so you find a place that takes a lot of Medicaid people, they don't have the same amount of money. It's not a fair fight, and they have to do it. And they should do it, because we've got to take care of people. Everybody's paid into the system.
And there's not unlimited Medicaid beds in a building, they're very limited.
That's a whole other discussion.
But we'll talk about that another time.
Very limited.
Brutal.
Okay, so now paying for it all. This is going to come out. A lot of this stuff, the complicated stuff, is why we have this as a series, so we can dive down. Because the easiest way to do proper care is private pay. Unfortunately, I'm not saying you go out and need to find the money, but that's just the reality. Long-term care policies. There is a benefit called for veterans, aid and attendance. Those numbers are a little low. They've bumped up those 23 numbers. It's probably 150
It's
more than
fine.
that.
It's like 16, yeah, without even doing that.
So that's a resource for folks that were in the service during a period of time that the Department of Defense prescribed that we were at war. So we're age, we just about lost our World War II service people. We're now sort of even aging out of Korea, and we're starting to see some more Vietnam.
I've had spouses too, don't they?
Yes. Yes, the lower number is what the spouse would get, and it's a stipend, not a reimbursement. So it's sort of like an extra Social Security check coming in. It's not going to cure high care. It's certainly going to help. I mean, that's not a small chunk of change coming in to soften it a bit. And the thresholds for qualifying for that are a little easier than what it is qualifying for Medicaid, which I'll get in a second. Reverse mortgages, real quickly, I'd say. So reverse mortgage, we talked about that house that we bought for 50 and it's worth 800,000 now. I'll take what's called a HECMA, or the home equity line credit, a HELOC, out, and I'll pay for things. No, you're not going to get dispossessed, but you are going to run out of money to pay for your care. So be careful about it. Again, this is planning. It's okay to do this, but don't do it without looking and making a plan. Retirement 2.0, right? Don't just say, oh, free money. Well, okay. But if you didn't think about it, it's going to come back and
It's gonna pay taxes, it's gonna pay all that stuff.
So Medicaid, and we'll get into this with the lawyers. It's public money. So to get on Medicaid in the state of Connecticut, it's basically you got to be down to $2,000 in income and $2,000 in assets. It's pretty low.
Yeah.
Okay. There are ways to get there if you have things. Spending down. You have to be careful how you do it, because the government wants to see what you've been doing the last 5 years. That's the 5-year look back.
Yeah.
Well, I had $1 million in my account, and I gave it over to my daughter. I signed the house over to my daughter. Well, if you did it 2 years ago, it's still on your books.
Yeah.
So you can't do it that way. There are ways to do it, so you got to be careful. Medicaid, real quick. Medicare is a health insurance. These are very different programs. They're great. We've all paid into them. We all deserve them. Medicare is a health insurance. Treat it like any health insurance. Think of it as any health insurance you've got. So it's not going to pay for housing except when I'm in a rehab, a short term. The doctor said, prescription, I need to be in a rehab. Okay? It's not going to say you need to be in assisted living. It's not going to say you need to be long term in skilled nursing. So it's a health insurance. Medicaid, an entitlement program. It's to pay for the medical expenses and care of seniors.
The disabled, the
disabled,
elderly.
yep.
Yeah.
And it's all in the news now too, right?
Okay.
So you watch that with a different thing. Southwestern Connecticut Agency on Aging, SWACA. Okay, there's a Connecticut home care program where Medicaid will pay, or Medicaid program.
Medicaid program pays for, that's the Medicaid program.
It's a blending of money,
pays.
just so you know that there's state and local money in Medicaid. So this is a great program. It's got its limitations. We have somebody from SWACA coming next time. We'll really drill down into what's there and what's capable. That's those local lifelines we want to talk about. a really great option. So to answer your question, there are things, but the panacea is Medicaid, and there's limitations, and we'll go into what Medicaid will cover. That was the backstop, and it was built in the 60s to cover people for 9 years, and now it's covering the baby boom, which is a glut of people. So there are more people coming into the system. They turn 75 in 2020, the front end of it. And so it's coming for the next 15 years. And we didn't think they'd be living longer than that. Okay.
Okay, so we're at the end for now, at least. So care is different things for different people. It's very unique. So you need to have the conversation ongoing, as we said, before a crisis. We deal with crisis all the time with our clients, and really to just have this conversation and talk about all these things. Care in the home, bringing people in, you know, what does that look like? What do you want? How are we gonna pay for it? And don't wait for the crisis, you know, we wanna have that roadmap. Okay, this is what I'm gonna do. But realize that things do change along the way, and that you're gonna have to pivot along the way too. This is not written in stone. It is, you need to be able to change it should things happen, because we don't have a crystal ball.
Or Google Maps. Susan has a great phrase. She says, your mom deserves better than a Google search. So it's fine to go find the next book club book, or maybe even the book of vacation. If you're really talking about a loved one's care, you're not going to get enough information, and it's going to be slanted if you're just getting it from the internet. That's why over the next 4 months, we're going to bring you experts that you can tap into on the community. You'll bum rush them after the presentation, but you'll also have them in your Rolodex for years down the road when you need. You know how it works, you know the type of person that exists.
So here's information, just 1 second. So we've got information, we do a lot of content, just, you know, educational things, but we do work with families all the time. Oasis is a free service. We're a national company. We are your local people that handle all of Fairfield County and Westchester. The Bronx and Putnam, yes, it's us, and that's why we have our team back there too, of Ashley and Justin, that helps us. Yes, we do Putnam, not much in Putnam, I'll tell you that. And really, we are here to help you navigate the plan. You know, that's what it is. So now let's talk.
Quick question. Does Connecticut, New York have private homes where they have, you know, 5 different bedrooms?
Yeah, great
They
question.
used to.
Great question.
Question of the night.
Great
Wow.
question. We have a couple. They're
Okay,
much more popular around the rest of the country.
that's, yeah.
And the Department of Care,
No, department.
we need to do this in a
They
different
shut them
episode.
down, sorry.
They're in transition, some of them are.
Okay,
We have 2 within 20 miles of us, we used to have 7.
okay.
The 5 are caught up in the change, the new regulations for home care, which is gonna start to affect home care. Because those 1,500 home cares, part of the reason there were 1,500 home cares is because they were under the Department of Consumer Protection. They've now just been moved under the Department of Health.
Which is, yeah.
The Department of Health has slightly different standards than the Department of Consumer Protection. And so there's some growing pains right now.
Yeah, so
It's gonna be an interesting time. Keep your eyes wide open,
No,
ask
but I
questions.
had a client that, because Arizona, Florida,
Yeah.
Maryland, even Jersey, I had someone that, you know, and they're very affordable.
They are.
We don't have them, it's not licensed, it's not how, I mean, at this point, not
It's
to
a
that
longer
extent.
story, it's a long
Yes,
story, they're
long
great,
story.
they're great,
Yeah, they
they're great.
With the, if you have someone who's been in Waveney with
Yeah.
skilled care specifically for broken hip and rehab, Medicare didn't cover the whole thing, so they used their long-term insurance. But you have a long-term insurance policy that you have got to reach 100 days before you actually get covered. They
No,
won't
there's-
cover it.
well,
Elimination period.
I'd have to ask more questions, probably what you're talking about is an elimination period.
Yes, the
So
elimination.
long-term care policies is basically a deductible. So long-term care policies, and I have to read the policy, they're all very different. Usually have a
90-day, 100-day.
Yeah, theirs was
Yeah,
like
an
100
elimination
days.
period that can go from 30 to 100 days.
Some have none.
That you're gonna have to pay, so you go on claim,
Right,
but they're not gonna reimburse until you've paid out for 100 days. There's strategies for that, why we wanna trigger it quickly,
right.
but if we're in skilled nursing, we're already down the road a lot.
Yeah.
Somebody needs an aide in the house, sometimes it's better to just like, hey, let's take this on, let's get those 3 hours a day for 3 days and get the clock ticking so that when something really happens, because we know things progress, that we've chewed away at that elimination period. But
Right, but it's
those-
hard to get
those
those days
policies-
to count, that's the question, is how do you get those days to count?
you have to,
I just went through this with my mom last fall, and they only counted like 4 days of the 50 days that
That she
we
was in,
were
yeah.
paying for.
well, that she was private paying for, or that Medicare was paying
Private
for?
paying, Medicare covered part, and then we were private paying the rest, in addition to then the days that we had somebody come to the house after she was.
Interesting. Yeah, we'd have to look at the policy and know the details, because they're really, the
So we
policy
can make
will-
an appointment with you guys, is that how it works?
Yeah, and for that kind of stuff, then we've got people that just do that,
Yeah.
you know, who really, because if it's complicated,
Yeah, it seems,
It's an insurance product, and insurance companies are out to, obviously make money, and there's the deductibles and the clauses. And the funny thing too is like, I'll work with a client who's 89 years old and has a great long-term care insurance and says, well, I don't wanna use it yet. You're 89, you know what I'm saying? So like, it's other people's money, It started early. Use it when you have somebody coming into the house, and burn those 90 days of elimination for when you really do need the $700 a day skilled nursing. They're very.
Or assisted living,
Yeah, assisted
right?
living.
Assisted
Yeah,
living
sure.
is filling that gap. Instead of paying that $700 a day, the assisted livings can come in at a fraction of the cost
Yeah.
and deliver that care where you don't have that one-on-one aid. So it's really kind of become, and that's where we come in. So you ask, how come we're free? 70% of the people that we work with is just this, talking about resources, referring them to other professionals or organizations that can help them be safe, be at home, get their ducks in a row. If someone needs to transition to assisted living, memory care, independent living, we work with 120 buildings. Every single building in our area we work with, we can help identify the right places, tour with you, work with you. We're like a realtor, we get paid by the buildings, but we work with them all, so it's all about what works for you, not about the building. That's
so for your situation, again, it gets specific, I don't wanna take a goose time, but they'll do what's called a respite stay. Remember, we said they have 30 or 60 day notice. Well, you can go in for 30 days. It's less than the skilled nursing, so if you're paying less and you start the clock ticking, or you get the long-term care policy to pay for it, and you're getting the care, now we have to always get the care, that's first.
Right,
But there are options.
You guys wanna mention elder life as a service? Or do you wanna wait? Okay.
Are you considered geriatric care
No.
managers then? Okay,
No,
so that's
geriatric
different.
care manager, we will have a geriatric care manager on the panel in 2 months.
Okay.
Basically, a general contractor for care, colloquially, we call them the other adult daughter. Okay, somebody's not here, parent needs care, I can't pay attention to this, I need somebody to hire the aides, to get her to the doctor's appointments, to make sure she's got stuff in the house, that everything's right. It's somebody you hire, you put them on retainer, and they'll have billable hours. Those billable hours can be $150, $200 an hour. They're not in there all the time. They're supervising everything. They're great, but
Some of them we know some that are nurses, that are GCMs, geriatric care managers, social workers. Some are just really good time management people. It's all but they're all generally part of ALCA, which is
aging life care.
Aging life care. So they're called aging life care people, managers, whatever. So
Nobody wants to be
ALCA
called
is-
geriatric.
They're not
care.
GCMs anymore, they're aging life care professionals, that's what they're called. Which is fine, whatever, but ALCA is the organization that they're licensed under.
A great role. So
Yes, we use
awesome piece
GCMs,
sometimes.
yep, or ALCAs.
GCMs.
Lots to learn.
Yes, sir.
The veterans benefits that you mentioned, are there income limitations on
More
that?
assets, It's about 150 grand.
For assets, how about annual income? Just assets.
Yeah,
It's
and
a financial piece is interesting. Lawyers talk about this, and I mentioned this that Medicaid, state and it's state and federal money. The states are different.
totally.
We're in New York and Connecticut. I'll give you one. This will move you to New York. So New York, when you're qualifying for Medicaid, and we look at because it has asset, it's the same sort of structure. Doesn't look at your IRA as an asset. As long as you're taking an RMD, you're taking the distribution, it's income, and income we can deal with. It's not an asset. If you move from Portchester into Greenwich and become a Connecticut resident, your IRA is an asset. So if I have $1 million spinning off $60,000 a year or whatever I'm doing, it's $1 million and it's exposed as an asset.
Yeah.
So we have people who move to New York just to get around.
First time I'm hearing New York's better than something.
Oh, well,
Yeah.
New York
New York Medicaid's better than Connecticut.
But, yeah, that's all that is. So, yeah. There we go.
Thank you, thank you.
That's
Thank
it.
you.